Good morning, everyone. A live look from beautiful Kauffman Stadium this morning. We are on the field ahead of opening day today. The Royals take on the Cleveland Guardians at 3 o'clock. Today, what you need to know ahead of heading out here to the stadium. Also, what young athletes can learn from how the pros are preparing for a day like this. Also, there's a new study, a new trial happening about concussions. Find out if you can take part. The morning medical update starts right now. Again, we are live out here at Kauffman Stadium. I'm Jessica Lovell. Thank you so much for joining us here on Facebook, YouTube, and also on Twitter. This morning, Kurt Nelson, the director of the Royals Hall of Fame, on what you need to know if you're heading out to the stadium today. And you are in good hands when you do get out here. Dave Smith, Community Partnership Team Lead, talks about fan care and how we take care of fans when they come out here to the stadium to watch the Royals. Also, Royals head team doctor, orthopedic surgeon, and president of the Medical Advisory Board for MLB, Dr. Vincent is here with us with how players have prepped for opening day. And also, we're joined by sports neurologist Dr. Michael Rippy. He is enrolling participants in a new concussion trial. He's going to get us up to speed on that and tell us all about it. So get your questions sent in to us on YouTube, Facebook, and the Medical News Network. You can find links to those right there on your screen. So joining me right now, we're going to kick it off with Dr. Vinsky and Dave Smith. Good morning to both of you guys today.
Good morning.
Hi. Okay. So, Dr. Key, I'm going to start with you first, because I know we only have you for a short while today. So, and thank you, by the way, for who just swiped this from?
Oh, yeah, we got the swag from our assistant trainer, Chris Deluzzi.
So. Yeah, I know. I'm borrowing someone's jacket today, and I do not care because it doesn't quite feel like opening day. It's a little chilly out here, but we're loving every minute of it. So, Dr. Key, I know you just said you just got back from Arizona with the team, where it's 93 degrees. How are you adjusting?
Yeah, it's not good today. It's cold. Yeah, it was 90 degrees.
So what's it like traveling back with the team and getting ready for a day like today?
I think the big part is our mental side is good. We're healthy going in, so it's good. The guys are ready to go. Everyone's excited. We have some new players, especially one playing third base today,
right.
So it's going to be exciting for the team.
So explain what your role is with MLB, if people don't know. What do you do?
Well, with MLB, we have the Team Physicians Association through Major League Baseball, and they elected me president this year. So a lot of that has to do with looking at different policies and procedures as it has to do with the health of the players, not only our players, but throughout Major League Baseball.
So are we back to pre-pandemic baseball?
We're close.
Okay.
I think from a fan's perspective, yes. From a player's perspective, we're still testing, but it's basically symptom related. And, guys, we're not quite in the bubble.
Right.
So things have been loosened up a little bit. So we're really getting close.
So today's the first game of the season, a shortened spring training. How did the guys get prepped for this?
You know, it was amazing how well the guys actually came in, and the guys were in good shape. Everyone, all through Major League Baseball, talking to other team physicians, we were all concerned about, you can practice, but practicing and spring training are two separate things. And it was really, really good. The guys were really prepared. I didn't have any concerns about any of our guys coming in. So from that standpoint, it was good. There's always a concern ramping up these players quickly that you could get some hamstring issues and some shoulder and elbow issues. But really, we've been doing really, really well.
So you're treating the pros, but what about the rest of us? What can be the takeaway? I know you treat the elite, but as everyone else is out there, especially kids, what takeaway can parents have when they're getting their kids or their student athletes ready to hit the fields in their sports?
Well, once we started, it's maintaining. And for me, honestly, and I talked to a few parents, that really the training regimen, getting these kids ready for baseball, should have been actually starting in January.
Right.
And pre-having these kids in terms of getting themselves ready. But once we get into the season, they can still do exercises. They should still be stretching every day. They should be doing their strengthening every other day or 2 days in between. Not just on the day that they're going to compete.
So does it ever get old, opening day, coming out here and just taking these first steps down onto the field and just kind of the anticipation of watching it all come together?
No.
No.
No. And this is what, my 12th season, I think, taking care of the club, and it never gets old. It's exciting. Like I said, we have a really, really exciting team. We probably have the most athletic team in baseball. We have athletes at every position, and hopefully it translates to wins this year.
Fantastic. Okay, I know you care for the big pro elite athletes, but you also have patients you care for, and I know you need to get to them, and I'm not going to let you delay one more moment, so I will let you go, get back to your other job, and we're going to talk with Dave now. So good to see you.
I appreciate you having me.
I appreciate you getting me this coat this morning. I actually have another coat underneath it, and I saw yours, and I was like, I think I need one of those.
The swag's ideal.
I need the swag. I need the swag. All right, Dr. Keith, thank you so much.
Right.
All right, I think we're going to get to our COVID count. So let's head back into studio. Alexis Delson is standing by with Dr. Hawkinson. I'll let you guys get us up to speed on our numbers.
I'm loving the swag.
Yeah.
Jess looks good in that jacket. I think she should try to see if she can take it home.
It's always good to get free swag. That's the
I
best
don't know
part.
if that's free, though. I think that's someone else's.
Yeah, it's free to her.
We'll find out, right?
From Vince.
So how are we looking for our COVID count this morning?
So the COVID count, we, again, have been having lower and lower numbers of active infections, and I think that's the important number that we're looking at. So right now in the health system, we have 9 active infections, 3 in the ICU, 1 on the ventilator, still 36 in that recovery period. But I would like to make a statement. We are going to be changing our admission and screening processes. So right now, and since really the beginning of the pandemic, we have been screening everybody who comes into the hospital for COVID-19 by PCR. So even if they're asymptomatic, if they are getting admitted to the hospital, we have been doing the PCR test. Right now, soon we will be stopping that practice, and it will just be for those that are suspected of having COVID-19, or if there's for some other reason the doctor wants to test them. So hopefully that will bring our numbers of active infections down, because we know not everybody here right now in this time period that is positive for COVID is actually here for COVID symptoms, but they may be here for other reasons. So our numbers may drop a little bit, and that may be more in line with what we've seen in other hospitals around the metro area as well.
So if you're here for a sprained ankle, they're not going to test you for COVID unless you're actively exhibiting symptoms.
Right, which we have been doing that the last 2 years. But now we are going to change that practice because, number one, vaccination immunity. We know that the circulation of the virus, although is still there, it is endemic. It is much lower, and we aren't in that surge like we saw with the Delta and Omicron surge. So there are various reasons. Now we may pivot back to going to screening with PCR for every admission, but right now we are going to be halting that practice. So.
Well, we want to head back out to Jess, who's live at the K on opening day. What a great morning. Jess?
It is. The sun is shining, and it's actually starting to warm up just a little bit. Yes, my jacket that I swiped from some guy is working very well, but it's actually starting to feel like opening day out here at the K. So it's really, really nice. And so we've been talking about the players and how they're prepping. So we're going to go from the players, and now we're going to talk to the fans who love them. So we got Dave Smith here to talk about fan care. How are you today? Ready for the day?
We are ready.
Never gets old for you either, right?
This is our 12th year out here. We love it every year. Never get tired of it.
So how do we prepare? How do we staff, I guess, an event like this? All these people coming out, not a care in the world, ready to have a good time. How do we do it?
So we have 2 first aid stations, one on the lower level, which we call plaza level, one on the upper level, we call view level. And then we have 3 what we call response teams, kind of strategically located throughout the stadium that we're never more than 2 to 3 minutes away from anywhere in the stadium.
So do fans come to you, or do you go to the fans, or is it a little of both?
It's a little both. If you have something minor, Band-Aid, headache, sinus allergy, something like that, just anything, come on in to see us. We can get you taken care of and back up to the game as quickly as possible. If it's anything a little bit more, in depth than that, we can absolutely come do that when our response team.
So from Band-Aids to bigger issues, kind of run the gamut a little bit on what we have the capacity to care for out here.
It's a little bit of everything. We are a BLS service out here. So we do see mostly, minor issues out here, but we have seen cardiac issues. We've seen hypertensive, diabetic issues, stuff like that. We have a physician on site for anybody that needs to be evaluated by a physician that can do that.
Anything different this year? How have we been handling COVID? I mean, kind of over the last couple of years, but what's it been like for you guys?
We follow the hospital's policies as far as protection, eye protection, mask. stuff like that, and that's it's a little bit different for us to try to do the distancing, which isn't always easy when you're doing patient care.
It's not.
But we do our best.
Social distance, not easy for people to social distance out here at a packed stadium,
not.
and people are having a good time,
Right.
and rightfully so.
Yep.
No better time to have them being out here cheering on the Royals. But anything else that we should know as we head out? Fans should know. I mean, obviously it's a very cool day today, but as we know, those summer temps are going to kick up there. Anything that people can do to prepare to stay safe out here?
In the summer months, we're definitely more busy with heat stuff like that. Today, we shouldn't see. I'm assuming we're not going to get any heat calls today, but just want fans to know that we're here, we're prepared, we're ready. And we take the medical part very seriously. We also take the guest experience part seriously. We help with finding your seats or whatever. We know the stadium as well as the ushers, or if not better.
You do. All right.
We
So
do.
you're on hand to help anybody
We
do
are.
just out here to have a good time. Make sure they stay healthy and have a good time
Yes,
and
have a
cheer
good
on the.
experience.
Absolutely, Dave. Thank you so much. Stick
you.
around if you will, and we'll take some community questions here in a little bit. People may have some questions about what to do when they come out
Sounds
here.
good.
So
We do.
awesome. Okay. So let's. I think we're going to head over. Are we going to head over to Dr. Rippy? We got a reporter. Do we have any reporter questions on the line? Let's get to those first. Nope, we are good. Okay, so let's get to Dr. Michael Rippy. He's a neurologist, a sports neurologist here with our health system. Dr. Rippy, good morning to you. How are you?
I'm well. I wish I was out there with you.
Well, it is warming up. You wouldn't have said it about an hour ago, but it is. It's turning out to be an absolutely beautiful day. So first, just explain to people what a sports neurologist does. What kind of care are you offering your patients specifically?
Yeah, sure. So a sports neurologist, we take care of injuries that may happen during a sporting event. So taking care of athletes, most of those are concussions, but we certainly see other neurologic injuries. Another big piece is helping patients who have a neurologic diagnosis, migraines, epilepsy, something like that, safely compete, try to optimize their participation in whatever sport activity that they're looking to do. Obviously, we're involved in development of guidelines and assessment strategies and those types of things of neurologic injury. Again, mostly that's concussion, but other things. We help optimize neurologic function to optimize sports participation. So, there's a little bit of performance enhancement or performance optimization there.
So, Dr. Rippy, part of your job is to help players and help athletes get back to the field and get that and accelerate that as much as possible. But what do you have to take into account when it comes to elite athletes?
Yeah, so elite athletes, they want to get out there as quickly as possible, right? So you've always got that stress, but you want to get them there safely. You want to make sure that you don't get them re-injured during the process or shortly after, so that you get them back into that peak performance as quickly as possible. And then there's things you have to think about with athletes as far as medications or therapies you may try, whether they're banned by the sport or something like that. So you have to take those into consideration as well.
Same considerations when it comes to our young athletes. I know you treat them just like you treat our elite athletes, but anything that our teens, our parents should keep in mind when it comes to putting their kids out on the field, getting them back?
Yeah, so it's always the same thing, right? I mentioned being aware of medications. You want to be careful that you don't put them on something that's going to actually reduce their performance. A lot of talking with younger athletes and parents is about safety, injury prevention, equipment, whether it's helpful or not, what kind of assessments they may do for a baseline. So those are the kinds of things we talk often with younger athletes and parents.
Dr. Rippy, you are enrolling participants in a concussion trial. Tell us about that trial.
Yeah, we're really excited about this. We've sort of used the tagline, rest is not enough, which actually is the rest is not enough. Restisnotenough.com is sort of the screening website we're using to help screen for participants if they think they may be eligible or interested. And the reason for that is when it comes to concussion, up front, we do talk a lot about rest for that recovery. And we don't have any specific treatments that treat the underlying brain injury. And so we're really excited to be partnering with a pharmaceutical company looking at a potential medication that may help Obviously, we don't know whether it helps, which is why we're doing this study, but some of the basic science behind it is really exciting and we think has some really good potential.
Very exciting. Dr. Rippy, if somebody's watching, first of all, we're going to put up a QR code so that they can get some more information. But if there's someone watching, what might tip them off that they might be a good candidate to reach out and find out if they're a good candidate for the trial?
Yeah, absolutely. So we're looking for somebody who has sustained a concussion. They have to be within the first 4 weeks. So if they're beyond that, they're not eligible, unfortunately. We are looking only at that early phase at the moment. It's ages 18 to 60, so we're not looking at adolescents or teenagers at the moment. That's the really, really basic. There's a few medical diagnoses that would exclude someone. We are looking for, patients who are still symptomatic. If they've recovered, they don't need, frankly, they don't need the medication. So those are kind of the really basic ones. Again, if they go to restisnotenough.com, there's a couple of quick bullet points on the website about the study, and then just a handful of questions that sort of screen them through that eligibility criteria. If they get through that questionnaire and they're eligible, it sends their information directly to our research team, who reaches out and contacts them and tries to dive further and again, if still eligible, and get them set up to come in.
Great information. And Dr. Rippy, before we go, it's just important to remind people we oftentimes associate concussion with sports, but people get concussions in many other different ways. Just talk to us a little bit about that.
Yeah, absolutely. We get a lot of coverage for sports concussion, but it's frankly actually a minority of what we see. We're coming out of snow and ice season, so slips and falls are going to start to decrease. But on the flip side, people are going to be more active and out doing things, and we see a lot of just the sort of the regular activities, right? Falling from a ladder, doing work on their house, riding a bicycle, car accidents. There's no out of season for that. So we see all injury types for all injury reasons, and are happy to evaluate everybody.
Dr. Rippy, thank you so much for joining us this morning. Stick around. We may have some community questions for you. Always good to see you. Thank you.
Thank you.
Okay, I'm going to let Cliff I think we're going to get some community questions, but just a quick shot real quick, Alexis, because I'm getting sprayed with the sprinkler out here.
I was wondering why she was turning
around. It's definitely opening day.
Yeah.
I got it right in the face. But it was right, with the crew. It's so great. Again, it really is starting to warm up a little bit out here, so it's really nice. Yes, plenty hydrated. So anyway, I just wanted you to see, yes, people are starting to get, Cliff, who's behind the camera, said, I said, do you think I could run the bases just for fun? He's like, I don't think so. I don't think we'll ever be invited back. The grounds crew will not be happy with me, but it's very tempting. I'm wanting to put my foot right onto that beautiful green grass right here, but I can't do it. So it's perfect. It's ready for ball today.
You're like a kid who's been told not to touch.
So pretty.
That's
okay.
right.
And all you want to do is touch.
Totally.
They should let Cliff run the
Totally.
bases.
Yeah, Cliff is like, don't touch the grass. I do. Okay, let's get to some community questions, okay,
We're
guys?
getting some good ones. We're getting some really good community questions. The first one is from Jean. Jean would like, Dr. Hawkinson, a discussion and your recommendations on that fourth booster shot.
Yeah.
Who should take it?
Wow.
When should they take it? How much additional protection will a fourth booster shot provide, and for how long?
Yeah.
It's a lot of questions.
That is a lot of questions. But these questions are really common. So we know that the FDA okayed or recommended booster doses for those that are 50 and older. We know that if you're immune compromised, they also recommended that additional booster dose. So if you're immune compromised, that would be a fifth dose. If you're not immune compromised, for most people, that's going to be the fourth dose. There is still a lot of expert opinion which is differing on this. We know that there was a recently published article in New England Journal of Medicine from Israel looking at third doses versus fourth doses in the time of Omicron. And what that showed was that there was a improvement in the risk reduction of going to the hospital, and especially having severe disease with the fourth dose. Now, again, even some of that data, some of the experts are questioning that data. So there is a lot of consternation. There is a lot of discussion even with the experts. But the FDA has recommended it. The CDC has followed suit as well. And I think if there is that chance, especially if you are in that older age group, 60 and above, and you are more than 4 months out from that vaccine dose, from your third dose, if we can reduce your risk of hospitalization even further, say from 75 to 80% risk reduction of going to the hospital and having severe disease to 85 to 90+% risk reduction in going to the hospital, I think it's a good thing to do. Now, again, understand that this virus is endemic now, so it is circulating in our community. But right now the rates are pretty low. So what are your chances of getting it? You have to take that into account as well. But if you are going out to restaurants, if you're going out to concerts in those large areas, you have to understand that you could be exposed to the virus. And so in that case, would it be reasonable to go ahead and get that fourth dose or that booster dose? And I think that's one thing that you have to start to take into consideration yourself, is what is your risk of disease? Obviously, if you had Omicron, so recently, maybe January, February, you could probably put off that booster dose for another 3 months or so, because you are going to get some natural immune boost from that. But the recommendation right now is that if you're 50 and older, if you are more than 4 months out from your last dose of vaccine, you can go ahead and get that booster dose. Really, the main thing that we're looking for here is, again, to help reduce your risk of going to the hospital and having severe disease. It's not necessarily against protecting against infection. So I think you need to make that decision. Talk with your medical team and your physician. It is safe. It will be safe. We know that. It's just a matter of do you feel like you need to get it? Certainly, I believe it. I recommend it. Seeing these patients in the hospital and understanding that our death rates and the number of people who died, say from January to March, of those 100 and plus deaths, only 4 of those people were fully vaccinated, and the rest were not up to date with their vaccine or not vaccinated. So we know that the vaccination continues to work.
I have a question for our experts in the field. When it comes to concession stands, would you prefer people stick with the cashless option as far as less money exchanging hands? I would imagine that's a question about protecting ourselves without having to do too much touching of things. Oh, well, I'll ask Dr. Hawkinson then. What would you recommend? Because we've talked about being in the governor's declared an endemic, but we're still in a pandemic, right? The both can exist at the same time. Yeah. So does that change your recommendations for safety at the K?
Yeah. Again, I think you're exactly right. It is still a pandemic for much of the world, especially those lower income or lower resource countries that don't have the vaccination. There's not a lot of difference, as we've talked about, pandemic versus endemic. Endemic just really means that virus is continuing to circulate in the community at some low level. So I think we have to understand that. As far as that specific question about cashless or not, I think it's probably quicker to go cashless. But as far as safety, if you're practicing good hand hygiene, again, the rules of public health and infection prevention go with you wherever you are. If you can practice that hand hygiene and do those things, I think it's just as safe. And again, if you're going out into the community doing all those things, you really should be up to date with your vaccination as well. Okay. Yeah, so hopefully that helped answer. But again, I think we're going to give another plug for hand hygiene. Just perform frequent and adequate hand hygiene. I believe there's probably alcohol dispensers, hand sanitizer dispensers out there. Yeah. Obviously, you can go into the restroom and use the soap and water as well. So
always good. We should always have been doing that before, and we should keep doing that now. Want to send it back out to Jess, who's field anchoring at the K this morning on a beautiful day. Are they still watering the field? Are you still getting water?
It's a good thing. Now I'm getting dust in my face. But hey, we're at the K. That's just what you do. In fact, these guys just came out and they were walking through our shot and they're like, oh, They're like, sorry. They're like, sorry, we're walking through your shutter. He's like, are you kidding me? We're standing down in the middle of a baseball field on opening day. You can walk through our shot. It's totally fine. Right. So we're kind of, so yeah, these guys got to get to work. They got fans coming out here very, very soon for that 3 o'clock game. So we want to talk about memories. Everybody has their favorite Royals memories, right? Whether you're a kid or when we won the World Series. So we want to talk about that. So Kate Bayer, she shared a memory from back in 2014, and it was that wild card game. She took some cell phone video. I think a lot of you remember this I think I had people at the game sending me this very same type of video. It was very, very exciting. Take a look. Oh yes, we all remember that. It was so absolutely thrilling. Okay, so that was when the game that we won. So they lost in the game 7 to San Francisco Giants, but of course a year later we became the world champs. So it kind of made it all better, right? So here at the morning medical update, so we all love the Royals too, as you know, and so our crew shared their favorite Royals memories. Take a look.
My favorite Royals memory has to be the end of the '85 World Series. You hear Denny Matthews with the call, high fly ball, Motley going back, to the track, no outs to go. Saberhagen jumping into George Brett's arms. It was a heck of a moment in Royals history and a real thrill for me. And plus I won a free dinner from a Cardinals friend of mine, so that made it all worthwhile.
One of my absolute favorite memories is more of like a whole thing that happened is when the Salvi splash really became a thing. Back in 2015, it was on billboards, it was on t-shirts, it was on bobbleheads. And back in 2015 on Halloween, my son, who was so little back then, paid tribute to Salvador Perez and the Salvi splash with his Halloween costume. It was a total hit. Everyone loved it. He got so much candy that Halloween. He was very proud of that costume. So that is my favorite Royals memory. We love you, Salvi. Go Royals!
So my favorite Royals memory was back in 2016, right after the championship season. My pastor and like 3 of my friends, we were all out at the game and we got on Crown Vision. We had our posters and we were cheering and it was just a great time. We were playing the White Sox and we won the game. It was just a good game and a good time.
My favorite Royals memory is a game that my husband and my daughter and I attended where this left-handed batter kept hitting foul balls up to where we were sitting. My daughter says, I'm going to catch the next one with my purse. And she did.
I'd have to say my favorite Royals memory is the time somebody gifted our office Crown Club seats. Just being able to get down and be right behind home plate for a game was just an amazing opportunity, and I'll never forget it.
My Royals memory is the Diamond of Dreams event. The first time I ever got to walk on the field at the K, it was 2010. It was the most awesome experience because I had never been on the field of a ballpark. And for the Royals, over the years, raising more than $500,000 to help charities. That's what makes it a great team, and I can't wait to see them. Go Royals.
Wow. When it comes to Royals memories, I have a lot of them. But I think one of my favorite ones came at the end of last season. My 3 sons and my wife and I were hanging out after the last regular season game, hoping to just catch a couple players coming out of the stadium. And guess who came out? Salvi. And he spent so much time with everybody around, signing autographs, taking pictures. And he was nice enough to do that with my 3 sons. And it'll be a family memory that we'll cherish forever.
I think my favorite Royals memory is just being able to experience everything that the K has to offer and being able to go there and watch a good afternoon of baseball or an evening of baseball and to be able to take it all in. I'm a White Sox fan, so it makes it a little bit interesting going to the K and watching the game. I still like the Royals a little bit, but yeah, every time I've been to the K to watch a White Sox game when they play, I think the Royals have won on 9th inning walk-off just about every time. So good luck for the Royals at least.
Alex, we love you anyway. We'll take you any way we can get you. We're going to turn you into a major Royals fan. And Logan, yeah, that was my memory too, when we all got spoiled and we got to sneak out of work a little early. and go sit behind home plate. That was really super cool. So I'm glad you brought that up. Okay, so we're going to talk about your favorite memory, Kurt. Kurt Nelson, Director of Royals Hall of Fame, joins me. I mean, hello. I mean, can we please talk about this
Yes.
Royals outfit? And as we scan up, I'd like you all to see this little nugget. Tell us a little bit about that favorite memory.
Diamonds are our boys' best friend.
Yes, they are.
Yes, that's the 2015 World Series ring. So it's not just the players that play for the ring; it's everybody that's in the family.
Absolutely,
it is.
It's a family affair. It is not just them. So, just well, first of all, I have to ask, what's it like just to be down here? You know, just today is the day. It comes around every year. It never gets old, right?
Today is the day. It never gets old. This is my 24th opening day as a member of the Royals, and let's see, it's like 26. I came to a couple as a fan as a kid, and each one of them is special, and just getting out here and seeing the ballpark get full again and get a season started. We're just really looking forward to it this afternoon.
All right, hopefully it'll get a little bit warmer. But what should people know when they're heading out? Anything different this year?
You know, as far as safe health and safety protocols and everything, public areas were really sort of wide open now, and people are able to freely move about the stadium. Dr. Hawkinson was pointing out about hand hygiene. That's still a key out here at the ballpark. There's hand sanitizer dispensers around the ballpark, and we encourage people to take advantage of that. And there are masks available if you feel uncomfortable and feel like you need to have a mask at guest services and that sort of thing. But really, we're sort of wide open back. Every seat is available for fans, and they can move about the ballpark. So we're getting back to what I guess we would call normal.
Yeah.
I don't know that there is such a thing as
We call
normal,
it kind of
but
that. It's not.
we'll go pre-pandemic.
Pre-pandemic,
It's
that term we use, right? Anything new this year that people might expect or be able to enjoy out here at the park? Anything?
You know, we're really trying to focus on bring out the blue. So we really want to encourage people. Our fans have been great about doing this in general, but wearing blue, especially for the first game of a homestand. And we're going to start a new tradition by raising a home flag, and it's a 12-foot by 18-foot flag that's going to fly out in right field. It says home. It's sort of a pennant, and we're going to raise that at the start of every homestand beginning today, and that's hopefully will be a new tradition here. Get everybody wearing blue and just come out to the ballpark. We're gonna make believe like it's spring and summer. It doesn't feel like it right now. The sun's
I was going to say it's like a goosebump moment when you said that flag. I was like, no, it actually is a goosebump moment. But yeah, it's going to be fantastic. And you're not going to let me try that on after this?
Oh, I might let you try.
Okay. If I'm extra nice. Okay. Yeah. So good to see you. Thank you for being with us today. Have so much fun today.
Absolutely. Thank you.
Thank you. Yes. Okay. So who doesn't love the food at the ballpark? Guys, come over here. And this is my friend. We haven't even met. What's your name? Oh, we got to have our mic. Hold on. Hi. How are you?
Good. How are you?
Good.
Troy
Okay.
McKenna.
Okay. Tell us what you do out here.
So I'm the general manager with Aramark.
Okay.
So I oversee all the food and beverage and all the merchandise retail.
I'm going to put this
on
there.
behalf of the Royals.
Okay. So you're going to feed me this morning.
I am feeding you.
Okay.
This morning.
Oh, sorry, guys.
Okay,
Okay.
let's go.
All right. So what do we have in this magic box?
Our company dared all of our chefs to come up with a Dare to Pair program. So our executive chef, Johnny Wojciech, came up with Sweet Baby Ray's pulled pork.
Okay, I'm going to lift up this bun.
Pulled pork with Reese's peanut butter cups and bacon bits.
Oh my God! Okay, and I'm trying this right now.
And you are trying.
Are you doing it? Who else is going to try? Who else?
Dave was trying it, aren't you, Dave?
Dave, get over here. Oh my gosh. Okay, so Reese's peanut. Where did this idea come from?
So
Who came up with this?
2016, when Chef Johnny moved here, he was having a fire pit party with his neighbors, and the kids wanted s'mores. He goes, "I'll do one better," and he got pork belly.
Yeah.
With Reese's peanut butter cups, smashed them, gave them to everyone, and they loved it.
Cheers. Okay, let's do it.
All right.
Oh, stop it.
No.
It's sticking. Oh my God, it's sticking to the roof of my mouth. It's as it should.
That is good.
This is genius. This is delicious.
It is. If the medical field approves, then we're good.
We approve.
It's approved, right? Okay, this is the splurge of the day.
Absolutely.
Oh my God, I'm gonna chow down on this, Alexis. I'm gonna send it back over to you so you can tell us. Sorry, I know we're going to our heart show later, but
you don't want me to ask you lots of involved questions as you take giant bites of that sandwich? That looks so
TBD.
good.
Please do. Please do. And hey, Alexis. Hey,
Yes.
Alexis, do me a favor. Hey, Alexis,
Yeah?
tell us about what's coming up, and then send us, and then take us out.
Okay, so you
tell
can
us what's
keep
coming up
eating?
tomorrow too, if you
I
don't mind.
got you.
Yeah.
I got
Wow.
you.
Yes.
You know it's good.
Live TV.
Jess is telling me to finish
Never
the
fails
show.
to amaze. Yep.
Well, I have a far less sexy topic than Reese's peanut butter cup stuffed in a big barbecue sandwich, but
Right.
it's a universal topic coming up on All Things Heart. It's menopause. You've either been through it, this is why it's universal, you will go through it, or you know someone who's going through it or will go through it. And the symptoms can be brutal. Hormone replacement therapy, also called HRT, can help. So you'll meet a Kansas woman who's not at the age yet, but she's already planning ahead.
You know, it really was something that made me think more about my heart health.
Because heart disease runs in Shannon's family, she's already thinking about if that will affect things moving forward if she's a candidate for hormone therapy. We're going to speak with an OBGYN and a cardiologist. We will answer all your questions about menopause, hormone replacement therapy, and the heart. That's all coming up at 10 a.m. So bring your questions. And as Jess continues to chow down on that amazing food out at the K, I'm going to take us out. Or are we going to go back to Jess? She's waving her hands. Nope, she's shaking her head no.
I think she's excited about the sandwich.
All right, I will let you off the hook. Remember, you can catch us anytime by logging on to Facebook, YouTube, and now Twitter for the Morning Medical Update, hosted by Jessica Lovell, who's very happy right now because she's getting that sandwich. And then coming up tomorrow, she's going to tee up and improve her swing. The Masters is underway, and the technology that can help your golf game. And we're going to show you why getting outside this summer, even if it's to play Frisbee golf, is the way to go. So we will see you live. Jess is going to be at the Sports Medicine and Performance Center tomorrow, beginning at 8 a.m., while Hawk and I hold down the fort here.
Yeah, we'll try.
Have a great morning.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.